Good morning, everyone. Welcome to Vital Wisdom with Dr. Eli Camp. That's me. Today, I would like to talk about detoxification. There is so much out there on the internet, so many books that have been written, lots of practitioners talking about detoxification. And I'm going to present this to you from a naturopathic medicine through the lens of vitalism perspective and how I think of it, how I do it with myself and my family, how I guide patients and friends and folks through this. It is a very important part of establishing and maintaining health. And there are definitely some really great ways to do this and some not so great ways to do this. We're going to talk about what it is. I'm going to talk about something called toxemia. I'm going to go over Emunctories with you. Thank you, Dr. Thomas Cruzel, for your amazing teaching and mentoring in that particular area. What it means to restore normal function. I'm going to go over a number of different therapies that are very helpful for detoxifying the body. I'm going to talk to you about a rest phase and some cautions. So let's just jump right into it. So when folks talk about detoxing their body, when anyone talks about that, really the ultimate goal is to have a body that is cleaned up of toxins that might be causing symptoms of illness. And right now, and I've talked about this in several episodes, we live in an ever increasing world full of many different kinds of toxicities, especially in the food we eat, products that we use, the air we're breathing, and the energy, whatever kind of energy, electromagnetic, radiation, the societal energy patterns that surround us. And we know that accumulated toxins, all of those things I just mentioned, can cause symptoms of disease when our body cannot process them out at an efficient rate, at a quick enough rate, etc. So this, in my opinion, is a noble goal, reducing the toxic load on the body. And then we end up with a body that's happier and working as it should and detoxifying. We have all these lovely built-in systems within our body to do this, right? Because nobody lives in a pristine, pure environment. Well, we can't do that. You have to be in a bubble to do that. But within medicine, this idea of detoxification is viewed differently depending on the paradigm of medicine that you're part of, that you're treated from, or that you use to treat other people. And most folks, when I start working with them or having this conversation, they think of detoxification as doing something to the body to push toxins out. And indeed, as I have been meeting with people over the years, I also use this language. I talk about what we can do to help clean the body, to detoxify it. But there's a deeper story here. There's a way of understanding this process of detoxification that I'm going to go into greater detail about. And why is that? Because from the vitalistic paradigm, the idea of detoxification is viewed in a different way than the dominant system of medicine. And many well-meaning practitioners out there view it, how they approach it. The ultimate goal is the same. How we get there is different. So the ultimate goal, a body that's no longer toxic or is no longer over toxic, so is no longer in a state of toxemia, does not need to exhibit signs of toxicity. And these symptoms that many folks diagnose as various illnesses go away because the body doesn't need to exhibit those symptoms anymore. So I think to understand the deeper meaning or the vitalistic approach to this, we first need to understand toxemia and something called the emunctories of the body. And again, I have to give credit and thanks to Dr. Thomas Gruzel because I learned so much from him about this. And it changed the way I thought of detoxification and how I worked with people in my practice. It was one of those transformative lessons. So first, let's talk about, I keep using this word toxemia. What is this? Well, toxemia is a state of auto-intoxication, right? Our cells are poisoned. And it results from the accumulation of toxins, of poisons in the body. And the source of the poisons could be either from without, out externally, or from within. Poisons taken in from externally arrive as, incorrect food, impure water, air that has been contaminated, disturbed mental and emotional interactions would be an example of things that are happening from within. Trauma, especially childhood trauma and toxic relationships, which are not thrown off by the body because it's already in this, we call it enervated state, so it's unable to get rid of those or as much of it as it needs to. Other poisons from within are toxins that are formed within the body as part of the normal processes of metabolism. Now, whether it's coming from outside or inside, these poisons within the bloodstream and tissues of the body cause the vital force, right, to make efforts to eradicate the toxemia. And many times these efforts are called a diseased crisis, where we're trying to throw off toxins, they're circulating through the body, maybe our pathways, otherwise known as our emunctories, are not open and flowing, and our body can't really get rid of what it needs to. And we get this stagnation and accumulation of filth and poison in the bloodstream and the tissues, which the body that's already not as healthy as it should be or properly functioning cannot resolve, right? And this diseased state ensues. And let me tell you, the diseased states has all kinds of labels: migraine headache, chronic fatigue, fibromyalgia, even things such as MS or other types of degenerative disease. It's not necessarily something from the outside that has caused this to happen. It is a body that is not able to function as it was designed to function and to clear the toxemia from the body. Dr. Henry Lindlar, who is a very important person in the field of naturopathic medicine and in our history, a teacher, a mentor, he taught that the three primary causes of disease and premature death are lowered vitality, abnormal composition of blood and lymph, and an accumulation of morbid matter and poisons. Dr. Lindlar said these three things. He and many others talked about how disease is the result of transgressions of natural laws in thinking, breathing, eating, dressing, working, resting, as well as in moral, sexual, and social conduct. we create imbalance, or imbalance happens in the body, and it expresses itself in each human in a set of symptoms. And then these symptoms over the years in the dominant field of medicine, they started to name them various things, when quite simply it is this imbalance that is happening within the body. One of the first books I read in medical school was The Organon of Medicine. It was written by Dr. Samuel Hahnemann. And I read it because one of my other teachers, Dr. Jim Sensenig, told me to read it. And later, right, as I was going through school, it turns out that it was a required book in the curriculum. And we talked about it in clinical training almost on every shift with Dr. Stephen Messer. It's a really important book to help keep me grounded in understanding health and disease. And I read it every year. Every year I reread this book. I use it when I'm teaching my students homeopathy or when I'm teaching nature cure. And in paragraph 77 of the Organon, and I think that's the 6th edition for anyone who's wondering, Dr. Hahnemann wrote, diseases engendered, in other words, brought about, so diseases engendered by prolonged exposure to avoidable noxious influences should not be called chronic. I'm going to say that again. Diseases brought about by prolonged exposure to avoidable noxious influences should not be called chronic. And these include diseases brought about by the habitual indulgence of harmful food and drink, all kinds, any kind of excess that undermines health, prolonged deprivation of the things necessary to life, unhealthy places, especially swampy regions, dwelling only in cellars, damp workplaces, or other closed quarters, lack of exercise or fresh air, physical or mental overexertion, continued emotional stress. These are the main things. These self-inflicted disturbances go away on their own with improved living conditions. And if no chronic miasm is present, they cannot be called chronic disease. So basically, what did he say? Disease, most disease, is a result of the way you live your life. And if you find yourself in your 40s, 50s, 60s, or older, and you're suffering from disease you've been diagnosed with, it's really important to take a look at how you lived your life up until this point, because that's what needs to be changed. And if you're young and you don't have any diagnoses, you have a beautiful opportunity to correct things now. And if you're raising children, you have the best opportunity to set them up for a very high quality of life where they're functioning in optimal health and reaching their highest potential, which is the goal for all humans, I think. So I mentioned that we have these built-in pathways, these routes of that toxins can be eliminated from the body. And I used to simply call them detox pathways until I started learning from Dr. Cruzel and learned this word, Emunctories. And Emunctories are the routes through which a healthy and normal functioning body eliminate toxins as it was designed to do. Remember, always in vitalism, we believe the body is able to heal itself. And then that extends naturally into this idea of cleaning toxins out. Toxins are causing a problem and creating illness. Well, the way the body heals itself is to clean those toxins out. It comes from Latin, the term emunctories. Emungere, I think is how it's pronounced. It means for wiping or cleansing, and it describes an organ or a duct that removes or carries waste from the body. And the emunctories help our bodies eliminate anything that does not serve the higher purpose of the organism. And all creatures have this. And as a whole, when when we're not doing that, when we have inefficient removal of waste products, we get these symptoms that look like illness and end up with a diagnosis, and then these things are treated like they're separate entities. There's a few words that I just like a little vocabulary here. Emunction is proper physiology working well to process, filter, and eliminate toxins and waste products. It's emunction. It's our body doing naturally what it was designed to do. Detoxification, by contrast, is a word used to describe an external force imposed on the body to drive out impurities. So emunction is a passive process. We can think of it, right? It's a natural result of optimal function, while detoxification is an active process of eliminating perceived contamination. Another word that's used frequently when we're talking about this process of detoxing and cleaning, getting rid of toxemia, is drainage, which is the stimulation of internal organ systems. This eliminate waste products in order for them to be eliminated by the emunctories. So we drain the organ systems and then send the body sends those through the emunctories to get rid of. So the primary emunctories, as you might imagine, are the bowel, right, where we move our fecal matter through, kidney, lungs, and liver and skin. Bowel, kidney, liver, lungs, and skin. These are the primary emunctories. But there's others. The secondary organs are the stomach, spleen, the lymphatic system, our mucosal surfaces, and our sinuses. Modern day often includes the male and female reproductive systems and the mind, right, the psyche. So it's really important to understand that when the primary emunctories are not functioning optimally, the body has this backup plan and will use the secondary emunctories. There's so many examples of this within the design of our body where we have backup systems, right? If you have cardiovascular system that gets clogged or isn't working right, our body creates new tissue, new pathways in the cardiovascular system. Well, the emunctories, it's the same way. We have a backup system. The secondary emunctories are not as efficient, and they can also become disturbed and not work the way they should. And often we can see a generalized inflammation happen. If this is so important, this may be the most important single concept I'm going to say today in today's episode. If the emunctories are not open and flowing, and detoxification is forced on the body, more and not less, illness can result. When I was teaching down in Florida, when I lived in Florida, I taught at Everglades University in Sarasota. And I don't remember in which class I was, but all of a sudden, one day, about halfway through the semester, and it was a 10-week, 4-week, I don't remember. Anyway, all my students were showing signs of illness, and not contagious illness, muscle aching and headaches and fatigue and abdominal complaints and trouble thinking. And this was like 75% of the class. And so I said to everybody, what is going on? Did you all go out and party, or what happened? And it turns out that another instructor in the program was giving them something called the Miracle Mineral Solution, MMS, in very high doses to help them detox. Well, most of those folks were pretty early in their training, and there's no way all their emunctories were functioning the way they should. And so the substance that they were given was forcing toxins from within the body, but the body's natural route, the emunctories were not open and flowing, and these toxins were circulating through their body and causing a lot of problems. So I had a chat with the instructor, but what I told my students was stop doing that. Stop doing that. I want you to drink water with lemon. I walked them all through doing a hydrotherapy. I told them to do it once a day for a week. And by the time, we came back to class, I told them I would have talked to this instructor, and either they were, overdosing on this MMS stuff, or their bodies were not able to detox this mass release of toxins within their body. We got it all worked out. And I think I won a lot of people over to the side of vitalism because of that experience. And I think I even paused and did a lecture on opening up the emunctories and what we can do. So there's also a lot of really great folks who have come before me who have taught us how to do this. So Dr. Gerard Genois gave us the 4 pillars to address to keep the emunctories working. Number 1 is food and digestion. And if you work with a vitalist, you probably hear more than you've ever wanted to hear about food and the digestive process, right? So we have to put good food into us, not food that acts as poison, but food that acts as medicine. And then we have to make sure digestion is happening properly. And that means breaking those molecules, the food down, so we get molecules that we need that then pass through the intestinal tract, and we absorb what we need in the right places in the intestinal tract. There's lots of folks out there who are they're eating really good things or drinking really good things, but their guts are a mess and they're not absorbing. They're not breaking down things into the pieces that they need to be broken down to, and they're certainly not absorbing it. In other words, they're not digesting what they're taking in. Number 2, so that was food and digestion. Number 2, Dr. Genois says, is elimination. So drainage, loosening up those toxins and getting them over to the emunctories. Breathing and physical activity. We were designed to move. We need to breathe. Humans today don't necessarily do enough of that. This energizes lymphatic flow, right? So mental processes is number 3. There are impulses, emotions, and intellect. And then number 4 is individual terrain, the specificity of each individual. It's the inner being with its capacity to react to an external aggressor or external influence, to behave in the world, and to deal with all that we come in with and heredity. So food and digestion, elimination, mental processes, and the individual terrain. So to have a body that is capable of eliminating the external and internal toxins, of clearing toxemia, we have to have a body that has been restored to individualized optimal health with properly functioning emunctories. It's important. You don't want toxins and toxemia increased without a way for the body to resolve it. So Lindlar also had some stuff to say about restoring normal function, right? And therefore allowing for the normal cleansing of the body. And we need to focus on 3 things, he said. Return to nature, so the establishment of normal habits and surroundings. This is extending our consciousness, broadening our mind, understanding, gaining knowledge, and ultimately wisdom by general and individual education. We need to be teaching people this, and we need to be willing to learn this. The constant exercise of reason, will, and self-control. That leads to a whole episode on how you think. How do you train yourself to and not to think in certain ways? They're very important. How we think, what we think. Returning to natural habits in life. not only in thinking, but in breathing, eating, dressing, working, resting, and again, moral, sexual, and social conduct. And then the other part of returning to nature is correcting defects and injuries by means of massage or chiropractic, osteopathic manipulation, surgery if needed, and other mechanical means of treatment. So a variety of therapies that restore proper form and therefore function. So that's number one, return to nature. Number two, the economy of the vital force. So we want to prevent wasting the vital force by stopping the leaks. And what causes leaks? Well, poor sleep, poor food, a whole bunch of stuff, right? Everything that creates a state of imbalance is wasting the vital force. It's like a dam that has a hole in it, and we have this leaking happening, and we haven't plugged it up by recreating this very important this condition for ourselves of feeding ourselves and giving our body what it needs and removing things that are poisoning it. So we need proper rest and sleep. We need proper food and hydration. Lindlar talked about magnetic treatment, so adjusting the polarities within our body and also the right mental attitude. And then elimination. So this was number three. This is one of the ways that they taught and is still taught and used today by the vitalists, which is elimination. So selecting your food and drink so that it is nourishing, fasting periodically, hydrotherapy, which in his time was known as water cure, doing light and air baths, friction on the skin to stimulate lymph and circulation, the chiropractic or osteopathic work, adjustments, massage, other manipulative treatment, correct breathing, curative gymnastics, and don't think Olympic gymnastics here. Think walking, stretching, lifting, yoga, things like that, and the medicinal remedies that will help build up the blood to a normal basis and supply the system with what it needs as far as minerals. And you can think trace minerals and cell salts in this realm. So between the two, we know we've got to make sure our gut is working. We're giving our body the nutrients it needs and withholding things that poison it. We're moving, we're breathing, we're resting, we're sleeping. We make sure that our body's form is proper and return to proper form. If it's not, we are being careful and using self-control in how we think, using more optimism than pessimism, and responding instead of reacting, things like that. One of the really amazing things about vitalism is that there are many, many therapies used by different practitioners, and that these can be used to help our body naturally detoxify, meaning we are restoring normal function so the emunctories can just simply do their job, right? These therapies and strategies that I'm getting ready to go over with you assist the body, but do not force detoxification to happen in a body that has emunctories that are not able to handle that. So fasting and food. Fasting is the reduction or elimination of food intake for a period of time. And there's lots of great books written on this, that many lectures talking about autophagy, which is where if you fast for 24 or more hours, but not too many hours, you are able to sort of boost your body's ability to go in and scour for dead cells, damaged tissue, cancer cells, fatty deposits, tumors, abscess, and they're burned for fuel or they're expelled as waste. And once we eliminate these obstructions, the immune system is able to function much better, and our metabolism is able to work at an optimum state. You restore good digestion and elimination, peristaltic action, which is the contractions in our intestinal tract that help expel feces, right? These are restored. And we give our digestive organs a very deep physiological rest. And this energy that would have been used to process food and all the stuff we're taking in instead can go into self-healing and self-repairing. By eliminating obstructions, cleansing, detoxifying, purifying the intestines, the blood, the cells, we really can overcome many of our physical ills, right, that get then diagnosed, our handicaps, as well as getting a boost in energy. Fasting not only helps remove the obstructions and helps the body heal itself, it's also rejuvenating and life extending. And these benefits can have lasting effects on your mental and emotional health as well. The other aspect is that your self-awareness elevates. If you're sick and depressed, then this might be one of the most important things you could try in your healing program, because it immediately gives you an energy boost and an increased awareness. It might allow you to see things more clearly. It helps you step out of your sickness and into a path of recovery. When you fast, you become more aware of your body process, your life, and everything you're doing. It becomes a period where you can evaluate all the things that you're doing objectively. And naturally, you have more time for contemplation because you aren't using time and energy to gather, prepare, eat, eliminate, clean up, all of that which is used to prepare food. You start to become more aware of what your body likes and doesn't like when you start to eat again. And you gain a certain confidence, a self-confidence in your ability to control your life process, to set a goal and carry out intention. And I'm going to have a guest on the Vital Wisdom soon in the next few weeks or a couple of months. He's a naturopathic doctor who really specializes in this. In fact, there's two I'm going to interview who specialize in this idea of fasting. There are some guidelines that you should keep in mind if you decide to fast. And if you decide to fast, you should check in with your doctor. Like, we're not talking about starving ourselves here, right? It's a limited amount of time, and there's other things to do. So stay hydrated. 2/3 to 1/2 your body weight in ounces of water, water with lemon, non-flavored mineral water, herbal teas that are naturally caffeine-free, freshly juiced fruits and veggies. Refrain from vigorous exercise and activity. Engage in relaxing and health-creating activities like bathing once a day, skin scrubbing, dry skin brushing, 1 to 3 hours of meditation each day, like yoga, maybe 15 to 20 minutes a day. Get out in the sun, expose yourself to sunlight, stretch. The sunbathing is like 15 to 20 minutes. We're not looking for a burn. We're looking to expose your body to the sun. Deep breathing exercises 3 to 4 times a day, journaling, massage, but not deep tissue massage, colon hydrotherapy, at least 10 hours of sleep in a dark, quiet, cool room each night. It's good to work into the fast over 3 to 5 days by decreasing and altering the foods. And then you work out of the fast over 7 to 10 days by slowly adding in foods that are acting as medicine and not poison for you. Always carry a small bag of emergency food, trail mix. A good recipe I like is 1 part walnut, 3 parts dried cranberry, 3 parts dried pineapple, and maybe some carob chips. Always use fresh and, if you can, organic. Well, organic is important. Fresh is important. Vegetables. Frozen foods are an acceptable replacement. I never recommend canned foods. During the main part of the fast, you avoid all meat, poultry, fish, beans, eggs, dairy, gluten-containing grains, nuts, soy, white rice-based foods, fried, grilled foods, candy, including chocolate. Carob is okay. No caffeine, sugar, except what comes naturally in the food, dyes, preservatives, additives, and processed foods. Be sure to use anything that that you need, that your practitioner has given you, that they consider essential. Maybe it's fatty acids, maybe it is B12 folate. That kind of stuff is important to work out with your practitioner. Too much protein can be very dangerous during a fast. It creates an overload on the kidneys. So don't do any more than is recommended. And if you have trouble with bowel movements, you can do a home enema. The type of fast you do really depends on your individual particular situation. So folks with type 1 diabetes or pregnant lactating women should always work with a physician who knows about fasting, and not every doctor does. You need to find someone who does. There's a few different kinds. You can do a water-only fast. That's what one of my guests is going to talk about, is water fasting, 7 to 14 days. The 16-8 method, intermittent fasting, involves skipping breakfast and restricting your daily eating to a period of 8 hours, and then you fast for 16 hours. The weekly or bi-weekly 24-hour fast is a 24-hour period of fasting for 1 or 2 days per week or every other week. And then the 5-2 method involves choosing any 2 non-consecutive days and eating only about 600 calories on those days. So for example, you might do Tuesday and Thursday, 600 calories, and the rest of the week eating regular healthy meals. So fasting is powerful medicine. And there's some really great books that have been written on it, and lots of really great practitioners out there who run fasting programs or who can guide you through this. Hydrotherapy is a very powerful tool. And, Nature Cure has its origins in the teachings of Vincent Priestnitz. He was born 1799, he died in 1852, and he never had any formal teaching in the healing arts. He learned from tending and treating animals on his father's farm, on his neighbors' farms, and he actually became one of the most famous healers of the 19th century. And it's he that set in motion the establishment of hydrotherapy as a medical concept, and it has been improved upon over the years. Knipe was a priest, and his water cure is still used in Europe today. Otis Carroll was cured of rheumatic fever and juvenile arthritis at an Institute of Natural Therapy under the care of a medical doctor who had studied under Knipe. He studied with that doctor and with Dr. Henry Lindlar, and he taught Dr. Harold Dick. A little bit of genealogy there. I learned from Dr. Harold Dick's daughter, Dr. Letitia Dick Cronenberg. He was the innovator of something called constitutional hydrotherapy. He added sine wave therapy and really made it into a system, into a treatment that was duplicatable. And he also brought in this idea that every person has an intolerance to specific foods. And so you really need to pair removing the foods that you have an intolerance to with the hydrotherapy to get the true healing. Now, in other episodes, I've talked about contrast therapy and heating wrap hydrotherapy. This therapy I'm talking about right now is constitutional hydrotherapy. And constitutional hydrotherapy was handed down to us by Dr. Carroll. It stimulates and supports the Emunctories and the natural processes that we commonly call detoxification. The difference between the one done at home and the one done in the office of a vitalist or other vitalistic practitioner is the use of the sine wave stimulation. You can buy a machine and you can do it at home. You just have to get some training on how to do that. So how do we do constitutional hydrotherapy? Well, the person to be treated should be in bed or on a table face up, unclothed from the hips up. You could do it completely unclothed if the person is comfortable with this, but usually I just unclothe from the waist up. We get 2 towels, very hot water, not hot enough to burn, but hot. We wring them out extremely well. We fold the towels in half and place one on the chest and upper abdomen. Then we completely cover the person or wrap them up like a mummy and a sheet and a wool blanket is best. If you don't have a wool blanket, you can find them on Amazon for about $30, but you could use other heavy towels. And that towel stays in place for 5 minutes. After 5 minutes, we unwrap, we flip the towel over. We put a hot towel, another hot towel on top, flip it over. We call it a hot flash. Then you put a cold, very cold towel on top, flip it over. And it's really important to get as much water out of that towel as you can and cover the person back up. And that person needs to warm up that cold towel. The body needs to warm it up. It takes about 20 minutes. It could take a little bit longer. We repeat the process on the person's back while they're laying face down. So if the person that you're going to do this treatment on is cold, you want to warm them up first. And you can do that with a hot shower or hot bath so that they're warm when they start this therapy. That is the at-home treatment without sine wave. With sine wave, there's more to it, and you really should get trained to do it before you do that at home. So the other thing that can help this the body eliminate are foot baths, and we can do hot and cold contrast baths. So you do, I usually do 3 to 5 minutes of hot and a minute of cold, and alternate 3 times. So they put their feet in the hot container, you wait, and then cold. You usually have to add hot water to the hot container to keep it hot. And you can add a few pieces of ice to the cold container to keep it cold. You repeat that 3 times. I get asked all the time about ionic foot baths. They come in and out of popularity. Manufacturers claim they can pull toxins out of the body based on changing the charge of molecules. Scientists claim they can find no evidence for this in using pre and post toxin tests. My experience with these types of ionic foot baths is mixed. Some people who have used them swear they improve the way they feel. Others report no significant change. So there may be some benefits to the ionic foot baths. I've read a few good biochemical and physics explanations about how they work. I leave that up to you. Like, I'm much more prone to just use the contrast hot and cold foot baths. Skin brushing. As people become aware of the importance of opening up the emunctories and restoring normal function so that they'll do their job, otherwise known popular as detoxification. The products and procedures are rising in numbers and price. And dry skin brushing is a quick and easy and very inexpensive way to remove dead skin cells, yes, but also stimulate the lymphatic system. And with the skin being the body's largest organ, it weighs about 6 pounds, depending on the size of the person. It covers almost 21 square feet. It is also a primary detoxification organ, right? We eliminate toxins through the pores. And it's hindered when our skin pores become clogged by foods we eat or cosmetics. And dry brushing helps the skin in both of those important ways by removing the dead skin cells and stimulating the lymphatic system. It also stimulates and improves the function of the nervous system. By dry skin brushing, you also help improve kidney and liver function by easing the burden on those organs. So you want to use a natural bristle brush, commonly available in most health food drug stores, department stores, about $5 to $10. A long handle makes this easy so you can reach all areas of your body. You do this dry skin brushing before shower, both to help make it a regular practice and because showering afterwards aids in the cleansing process. Also, brush towards the heart, always using long, soft strokes. This is not scrubbing your skin. It's a soft brush. And you want to follow the flow of the lymph in the circulatory system. Cover all the areas of your skin. Start at your feet and go up. Back, armpits, abdomen, both sides of the chest. Use a few clockwise strokes followed by a few counterclockwise strokes. And don't brush areas with a rash or broken skin, all that. It will not take you very long to experience the benefits of this. Castor oil packs were popular. This is the next one. They were popularized by Edgar Cayce in the early 20th century. And castor oil is a traditional natural remedy. It dates back to ancient Egypt, China, Persia, Africa, Greece, Rome. It comes from the castor seed of the castor oil plant, Ricinus communis. It's a large shrub, and they can be applied almost anywhere on the body, including the abdomen and joints. And castor oil packs are often used when treating symptoms of constipation, digestive disorders, menstrual irregularities, uterine and ovarian cysts, bursitis as part of liver support, and for a variety of skin conditions. And interesting, in 1999, there was a study that found the topical use of castor oil stimulates the lymphatic system, which of course assists the body to remove toxins. It promotes its own healing. And you don't want to apply castor oil to broken skin. You don't apply it to the abdomen. If you think there's appendicitis, it should be avoided during pregnancy and breastfeeding. But it's pretty easy to do. I use a flannel cloth, and organic castor oil cold pressed is best. A little baking soda to clean up the area afterwards, a towel. And what I do is I take castor oil, I put it right on the part of the body I'm trying to treat. I put the flannel cloth on top, and then I cover that with a little face cloth, and then with a towel. I like to use heat. I just use a heating pad over the top, and I leave it in place for 30 minutes to 2 hours. It depends what I'm doing with someone. Don't fall asleep with it in place. So heat promotes the absorption of the castor oil. It relaxes the internal organs, but you should not use heat if there's an internal abscess, right, or something going on deep in the body that you know about. If you don't know about it, you don't know about it. You don't have to use heat. If you don't use heat, you can leave a pack on overnight. When you're done, clean up the skin area with some baking soda, about 2 teaspoons in a quart of water. You can store that flannel and all of that in a container, and you can reuse it. Make sure that you use enough castor oil on the area each time. The next one is lymphatic drainage massage. It was developed in Germany to treat lymphedema, which we often see post mastectomy or anytime the lymph nodes have been disrupted. But today, our sort of modern quality of air, water, food, and other elements, right, they're leading to this buildup. And lymphatic massage can really help increase the volume of lymph flow by as much as 20 times. And this can really help open up that particular emunctory. If you're generally healthy, you can do it yourself. You gently massage the skin, soft. It's very soft. It doesn't take a heavy hand here. And you can look up online an image of where all the lymph nodes are. And you work upward, always again towards the heart. And you just gently rub the skin along these lymphatic. What I usually do is have people do some work around the neck and the upper chest, and then just sort of move that and open that up, and then start down at the feet, and then you can move upwards. There are people that specialize in lymphatic massage therapists. There are occupational therapists, nurses, physicians. There's lots of folks who can do a lymphatic massage for you. You can check out listed practitioners, although not everyone who does it is listed there, but at the National Lymphedema Network. You can also talk to your doctor, see if they know somebody. Another thing I get asked about frequently, in addition to the Ionic foot baths, is the infrared sauna. So sauna treatments have been used around the world for a number of reasons, for a lot of their health promoting benefits: improved cardiovascular health, pain relief, skin cleansing, improved sleep, stress relief, weight loss, immune system support. reducing the risk of certain health conditions like dementia, Alzheimer's, improved respiratory function, improved exercise performance. And there's so much stuff, right? And lots of evidence that they can help support the body in its cleansing and self-healing attempts. So a traditional sauna uses heat and humidity to induce perspiration, and infrared sauna uses light and lower temps. I tend to like the infrared saunas better. There's a number of supplements and teas that can support the body through its process of cleansing without forcing these toxins out of the tissues. And I stay away from heavy duty detoxifiers. And instead, I choose herbs and other substances that support the overall health and function of the body. I don't want to I'm not trying to force detoxification, right? I'm trying to encourage the restoration of normal function so our body can emunct. Remember, this is what a vitalist is doing. But a few things that I have found to be particularly useful are alpha lipoic acid. It's a very powerful antioxidant. It's very good for a number of parts of the body. It helps both in water-soluble and fat-soluble tissues, and it helps recycle another antioxidant called glutathione. Vitamin C supports immune function and tissue building. Dandelion, very rich in vitamins A, C, and K. It's anti-inflammatory. It has a lot of antioxidant action. It's a good source of fiber. If you're going to consume it, you can also, it's got fiber, calcium, iron, and magnesium. But in particular, you can eat it. You can drink it as a tea. Green tea is a great antioxidant that can help protect the body from oxidative damage. Probiotics, let's get the gut. The gut has to be in good health. It has to be, or it's right at the center of your being. And it does so much for us: digestion, immune function, all of the stuff. So very good. Fiber, psyllium husk, I like that. Fiber can also help remove toxins from the gut when we're having trouble evacuating. NAC, N-acetylcysteine, is helpful in preventing excess oxidative damage to the liver. In fact, it's something they use when there's been a Tylenol overdose. Milk thistle, in smaller amounts, it can help protect the liver against toxins and inflammation. And turmeric, the last one, turmeric, I think is one of the most powerful ones to consider adding in on a daily basis. But listen, it's anti-inflammatory, antioxidant. It supports digestive health, prevents cellular oxidation, helps protect nerve connections in the brain from inflammation and oxidative damage. It's a really, really amazing, and it's hard to get enough turmeric in just eating it. But I like people to include it in their foods, in their salad dressings, and their beverages, and turmeric in a capsule can also be helpful. I like to make sure the formula has black pepper in it because it increases the effectiveness of turmeric. Now, two more pieces here. When you are attempting to restore normal function, and that's happening, and your body starts to deal with the toxemia, it starts to emunct, one of the most important things is to remember that your body needs time to process toxins. And so if you're fasting, you have to decrease normal energy output. You have to. Your tissue needs time to heal and regenerate. But in general, when you are healing, sleep, take baths, sunbathe, deep breathe, and take time to relax. You have to do this so that your energy can be diverted to the healing. So I call this the rest phase. And then there's some cautions, right? You have to be careful with type 1 diabetes, especially pregnancy. If you're going to fast, always check with your doctor to supervise fasting, or you're going to do any kind of anything that's going to encourage your bodies to start to relieve toxins, right? People with liver and kidney disease should work with a professional, and folks on certain medication should only enter into this quote unquote practice of detoxifying under the care of a professional. But really, if you're doing it from this vitalistic perspective of restoring normal function so that your body can emunct as it was designed to do, There are less dangers and less risks for sure. I know this was a long episode. I'm so honored that you choose to take time out of your busy day to listen to what it is I have to say. So thanks for joining me today on Vital Wisdom, and I'll talk to you next week.